should you do IUI? I do see a lot of patients confused about whether they should plan IUI or if they should plan IVF. Let me tell you about IUI clearly and quickly. So IUI means intrauterine insemination. In this, we wash your husband's semen sample in the laboratory and we place it with a small narrow catheter into your uterus around the time of ovulation to maximize the chances of fertilization. Now, IUI is a simple procedure, it is inexpensive and it is relatively easy to carry out. That's why the tendency is to first try IUI. But are you a good candidate for IUI? Now, the success rates with IUI are around 10 to 15% or sometimes a maximum of 20%. And this means, let's say there are 10 couples trying IUI and out of those 10, maybe 1 or 2 get pregnant. The chances of pregnancy with IUI are good if you're young, if you have a good egg reserve, if both your fallopian tubes are open and healthy, at least one, if not both, and your uterus is normal. And last but not the least, your husband's sperm report shows only a mild abnormality, a low count or a slightly lower sperm motility. Results with IUI are not good if you're older, say above 35 or in your late 30s. Results with IUI are not good if you have damaged fallopian tubes or unhealthy fallopian tubes. And also the results with IUI are poor if your husband's semen parameters are showing markedly reduced count or motility. If you're someone who has been trying to conceive for many years, again IUI is not the right option for you because IUI is not very different from trying naturally. In IUI, all we do is that we give you maybe stimulation medicines to make your follicles grow. We do a follicular study to see when your follicle is getting ready, and once your follicle is ready, we ask your husband to provide a semen sample which is washed in the laboratory and which is put in your uterus. So again, chances of success with IUI are 10-15% or a maximum of 20%. There is no harm in trying IUI provided you are a good candidate for success with IUI. So if you're still confused about whether you should do IUI or plan IVF directly, do get in touch.